Monica, today is the 9th of the month. Don't forget to call your buddies. A new study in the journal The Lancet Oncology finds breast cancer survivors who've had extensive surgery are 4 times more likely to see a buildup of fluid in the arm called lymphedema. Its debilitating symptoms can hinder a patient's daily life, but a non-invasive, pain-free treatment is helping to bring relief. In the metro area, Sibley Memorial Hospital has the only rehabilitation center offering this new therapeutic advance called Lymphatouch. Breast cancer survivor Raya Kushner is stitching a sampler for her 3rd granddaughter.
It's something I love to do, and I have to finish it because I have to start her Christmas stocking, which has to be ready by Christmas.
Normally it would take Raya 3 months to finish a sampler, but this one has taken 8 months because her swollen fingers are no longer nimble.
After I do this for like about 15 or 20 minutes, I have to take a break because my hand starts to hurt.
The pain and swelling in Raya's hand and arm was so debilitating, it forced the 6th grade public school teacher to move up her retirement plans by 2 years.
It was just getting harder to grade papers. It was getting harder to be on the computer. It was hard to hold a pen. My arm would start hurting. My hand especially would start hurting.
You have your sleeves.
Margaret Wahlberg Silva, with the Center for Rehabilitation at Sibley Memorial Hospital, says she sees this a lot, especially in her breast cancer patients. It's called lymphedema.
Lymphedema will develop in any area where the lymph nodes have been removed or compromised, so they cannot fully function as a relay station to move the fluid out of the arm and to the next station where it would be absorbed and finally moved into the heart and out of the body.
Raya's lymph nodes were compromised in her battle with breast cancer. She had 8 rounds of chemotherapy, followed by a mastectomy, 36 doses of radiation, then reconstructive surgery.
Let's rest your arm on here.
The standard therapy she followed to manage lymphedema included wearing different compression garments for day and night, rhythmic massage, exercises, and arm wrapping.
We also teach them early on how to activate the healthy lymphatic system that they still have functioning.
Then Raya's therapist added Lymphatouch.
In layman's terms, a suction pump. The Lymphatouch, by applying suction, actually raises the skin, stretches the fascia, and opens the lymphatic vessels, allowing them to drain.
That's right.
And then allowing us to gently move that fluid in the direction that we want to take it. So let it relax.
Raya knows there's no cure for lymphedema, but the benefits of Lymphatouch seem to increase after each session.
It's not skinny like this arm, but it's a lot more limber.
It is not a magic wand. It's not the miracle tool, but it is a wonderful tool in our toolbox. And it does allow us to work in ways that are difficult to work with our hands.
Other ways to avoid triggers that might cause the arm to swell include avoid heavy lifting with the arm at risk, avoid insect bites, cuts, anything that could break the skin. Avoid any constrictions such as a blood pressure cuff, tight clothing, or jewelry. And avoid burns, extreme temperatures. Also avoid having blood drawn, IVs, or shots in the affected arm. You can join us in the fight against breast cancer, and you can see this story again on our website, WUSA9.com. Just look for Buddy Check under our Features tab.
Small